For the last couple of years, San Diego researchers have been checking sewage from treatment plants for COVID-19. It's proven to be an early indicator of when cases are coming, and a recent article published in the journal Nature details how that process can also quickly identify new variants.
The paper that was just published in Nature today by Dr. Rob Knight and colleagues, I was fortunate to be part of this effort, and it showed that the wastewater surveillance preceded our discovery of variants in clinical cases by 2 to 3 weeks.
UC San Diego Health's Chief Information Officer, Dr. Christopher Longhurst, says sewage is collected at 3 treatment plants across the county. He says the data gathering isn't just faster than testing in clinics, it's also cheaper.
Every one of our wastewater tests is in the, let's say, hundreds of dollars, whereas testing a clinical sample to find out, let's say if I'm COVID positive, which genomic variant I'm carrying, it's much more expensive.
Scripps postdoctoral researcher Joshua Levy says wastewater surveillance can be particularly important for areas where clinical surveillance is limited.
We can take one sample from the whole of San Diego in many cases and get a pretty good picture of what's going on, rather than having to sample each individual person.
The project is a collaboration between UC San Diego, Scripps Research, and state and local health departments. Researchers have presented the wastewater detection model directly to the CDC, and it's since been made publicly available.
Become pretty widespread, actually. It's used in state public health labs all over the country.
While efficient, wastewater surveillance can require substantial infrastructure.
You have to have testing facilities. You have to have the ability to monitor this on a regular basis.
Researchers can get variant information as fast as 3 days after sampling, but that process could be faster if testing was done directly at the treatment plants themselves. Right now, samples have to be transported for testing. The most recent data shows COVID infections appear to be leveling off or coming down.
That's encouraging to us in terms of the future, but we'll still see the impact of the circulating virus from 4th of July activities and other holiday, mixing.
Matt Hoffman, KPBS News.